Myeloproliferative disorders like essential thrombocythemia present driver mutations and also a higher platelet count. So several platelet alterations on their function were reported, like a higher reticulated platelet ratio and also some aggregation alterations on the potential. So we aim to investigate on ET patients these platelet alterations and also in alterations on thrombin generation according to the molecular profile. So we studied 22 patients with 11 with JAK2 mutation, 1 with MPL, and 3 with CALR, and also 5 triple negative patients. We studied platelet characteristic and functional assessment using flow cytometry, and the for thrombin generation we use automatic calibrated thrombogram or CAT. On these patients, we found a median platelet count of 600 platelet by liter and a median platelet volume that was normal. Patients had a median age of 51 years, and we studied 21 females and one male patient. When we studied the JAK2 mutated patients, we found fibrinogen receptors on platelets from JAK2 mutated patients had a decreased capacity on activation by agonist, TRAP, and ADP. And JAK2 mutated and triple negative patients also expressed similar levels of P-selectins after activation, similar to healthy controls, and a decrease on CD63 exposure was seen in these patients after TRAP stimulation. No significant differences were seen on von Willebrand factor receptors among these groups. And when we studied the plasma of these patients, we found that thrombin generation had a less thrombogenic potential on these patients because we found a decrease on the endogenous thrombin potential, or ATP, and also the peak and the velocity index were decreased. Platelets on the MPL and CALR positive patients also showed some alterations. Especially on the MPL patient, we found that the fibrinogen receptor was decreased and had a reduced capacity to be activated by agonists, by TRAP and ADP, but they showed platelets showed a basal exposure of P-selectin and CD63 that was increased compared to controls. On CALR patients, we found that all activations markers were decreased, and thrombin generation in these 2 mutation patients was very similar to what we found in JAK2 mutated patients, with a decrease on the ATP and also on the peak of thrombin generation. So this was important, and results were important because even it was a small number of patients, we found some alterations according to the molecular profile that encouraged us to study a bigger number of patients to find a characteristic pattern of thrombin generation and platelet functional alterations that may in the future help to adjust antiplatelet treatment on these patients, especially on patients that had bleeding complications. So that's the importance of our study.